Hi, I'm Doc Heff.
I'm Chad McDowell.
We are Easy Pain Solution. We're going to cover the ground progression for the shoulder series. Chad, what's the first thing you want to start off with?
Rolling on the back of the shoulder.
Okay, my favorite spot is to work just on the inside of the scapula. Chad's going to have to pull his arm across his body to expose the tissue. When he does that, he's going to slide the scapula over and allow us access to the areas that we're trying to liberate. Chad, go ahead and show us what that looked like. As he's doing this, he can leave his backside on the ground initially, and that decreases the amount of resistance that he's having to work with. He's mobilizing his arm through the entirety of its range of motion while he's got his arm pulled clear across his body as far as he can. You don't want to bend at the elbow and create the illusion of moving it much farther than you actually are. In a perfect world, his arm's straight like it is, and Chad's pretty flexible through his upper range of motion, so we want to work all of this. He's moving the ball inferior. As he slides along the scapula, he's going to raise his arm up across his face. Very good. Still maintaining that circular motion with the arm, so we're mobilizing. He's now covering along the inferior border of the scapula, along the inferior angle there. These are all the muscles you have, the rhomboid major, rhomboid minor, and the trapezius comes down looking like this upside down Christmas tree. Rolls out through these muscles. Chad's rolling over on the outside here and liberating the teres minor as well. The three bones that make up the shoulder are the clavicle, the scapula, and the humerus. The humerus being the arm bone and your clavicle being your collarbone. Those two bones have bones on both sides. The scapula only has bones on the outside, and then on the inside portion, muscles are responsible for keeping it stable. If those are tight and restricted, how do you feel through there, Chad, right now?
Feels good. Feels good.
So if you have a shoulder problem, one of the areas that we're going to address today is going to be responsible or contributing to the overall amount of discomfort that you're having. And we want to improve the range of motion and mobility throughout the entirety of the joint. As Chad's working through this region, he wants to work into and out of the pain, above, below, left, and right, and that'll let him know how large the area that we're trying to address is. Every time he works the ball over this region, he's going to improve circulation, improve lymphatic flow, and improve the mobility of the joint by staying off the onset of adhesions, which are the precursor to an arthritic development in a joint. Very good. So you work the backside, you work up at the top portion of the scapula. Between the two, up there and down lower, now he's raising his pelvis. Go up and do that again for me, Chad. So as he's doing that, he's raising his pelvis, and that's going to increase the angle. The steeper the angle you can get on the ball, the more pressure you're going to have directly on top of the muscle called the levator scapula. It runs this from the scapula up to the base of the skull, and it can contribute to a lot of headaches and tension throughout the neck. How's that feel there, bud?
Feels good. A little tender right here.
Okay, so when we find a sore spot, what do? Above, below, left, and right. We find out how big it is. Everything we find on one side, we look for on the other, because muscular-wise, our bodies are pretty symmetrical. Anything you make yourself aware of, you want to always pay more attention to. As the area improves and you get healthier, you might not have to do it as much, but you always want to pay attention to these spots because they're consistently going to be the ones that are giving you trouble. On someone else, it might be a little bit different based upon different lifestyles. Great. What'd you do there? What'd you do there next, Mr. McDowell?
I would probably come in here and go around to the chest.
Fantastic. So we're going to work the muscles across the front of the shoulder now. So we have pec major, pec minor, all the muscles up along the clavicle, your collarbone, trace from your sternum all the way over to the front of your shoulder, mobilizing the body. Chad's knees are on the ground right now, so he doesn't have a tremendous amount of weight on there. He can even drop down on his forearms if he wants to make it a little easier for him to do. If he's able to, just like he was doing, come up on top like you were doing there, Chad. On top of the shoulder like you were doing. There you go, good. So he wants to raise his backside to increase the angle that he's coming down on. This is a fairly advanced move, but it's going to liberate the top of the shoulder. These muscles run up right up into the side of the neck. You have these muscles called the scalenes, anterior, middle, and posterior. In and among those, all the nerves that come down and supply the hand are coming right out of this region. So numb hands that fall asleep on you, elbows and shoulder problems can arise from the nerves that are being compromised in this region. How's that feel, Chad?
Feels good.
Excellent.
I carry a lot of tension right here.
Everybody does. On a regular basis, we want to get in and liberate this tissue as often as we possibly can. So we've worked the inside border of the scapula, above and below, the inferior angle, into the teres minor, which is the armpit. All four muscles of the rotator cuff are attached to the scapula. The reason it's imperative to maintain good mobility between the scapula and the humerus, for every 2 degrees, raise your arm out to the side, Chad, for every 2 degrees that his humerus moves, his scapula is supposed to fan out 1. Without that 2 to 1 degree relationship, we strain the muscles of the rotator cuff. That progressive influence of that ends up promoting an environment that's rich for injury, and we want to reduce that and make that the opposite. So work this up and down. We did the chest, now we did neck. Lay on your back there, and on your side, I'm sorry, lay on your side.
Do the deltoid?
Yeah, do the deltoid. So you have three muscles that make up the deltoid, shaped like the Greek letter D, anterior, middle, and posterior fibers, and they come down and insert right on the middle of the humerus on the outside. He's got his elbow tucked tight into his rib cage. Right now he's down on the ground, and if he wants to make it a little harder, he can elevate his pelvis. He's going to scissors his feet when he turns to the side. Reposition your body to stay high center on the ball. This is going to ensure the greatest amount of resistance that you can. If the ball has too much pressure in it, Chad, what do?
I can take pressure out of the ball.
Take pressure out of the ball. This doesn't have to be a difficult equation. Create an environment where everything we're asking of you is possible. It's not always going to be that way. It's just where you start. You're also going to notice fluctuations in how you feel from day to day. If something is a little more sore than it was yesterday and it's a little too tender, let some air out of the ball. If you're feeling a little more like Superman and you feel like you can break stuff apart, get in there and put a little more pressure in. The size of the ball makes a difference as well. The larger the ball is, you're going to have a broader area of contact and less specific region. Smaller contact is going to be quite a bit more intrusive and liberate deeper and deeper tissues. The goal being to go as small and as much resistance as you can tolerate. Healthier tissue can survive all that and feel a lot better as a result. Again, every time we're doing this, we're stimulating circulation, stimulating lymphatic flow, and improving mobility. So we've done the scapula, the shoulder blade there on the inside, the outside, done the armpit, done the deltoids. Now I want you to do the side posture one, just like you did there for the deltoid. We're going to work the biceps and the triceps, as well as reach up behind your head and work the teres minor. So go ahead and assume a side posture there, laying on your side proper. Get right up on your side, right up on your right hip. There you go, reach back behind you, good. And your legs are scissored so you're good and stable. And his hand is palm down. I want him to roll palm down and palm up. And even though the muscle fibers are running from the shoulder down to the elbow, we want the ball to maintain a serpentine motion from the origin to the insertion. The origin being where the muscle hooks in, and the insertion being the portion of the body that moves. In this case, the biceps are hooked into the shoulder, and they run down to the muscles of the forearm, allowing for this motion. This is a lot like reaching into the back seat. That's the general. Is that about what it feels like, Chad?
Yeah,
okay.
yeah.
Unless you ride a sporty little two-seater, back seat isn't an issue. So then you want to pull the elbow down to the side again and work the deltoids just like you did before. Rock right up on your side. Good. Now reach out in front of you and let's get that tricep. Very good. Now his legs are scissored again for stability. He's using his other hand to help stabilize as well as improve the pressure that he's got working up and down the back of his tricep. Just like on the bicep, we want to work from origin to insertion. In this case, it's on the back side of the arm all the way down and past the elbow. Where do you feel, if you're going to find more tenderness, is it on one side over the other, Chad?
It's right by the elbow right in here.
Most of the time. Now, do you notice right side or left side is more problematic for you?
Right side.
It'll vary from individual to individual. Mine is much more left side for whatever reason. And we want to work the tricep all the way through? Good. Now we're going to work up through the teres minor as well as some of the lat muscles. So reach out to the side there, lay right on your side, put that arm. Chad's pretty flexible, so we want to raise that arm and put it behind his head. Very good. And even pull that even more to expose as much of the tissue. If you can't, go ahead and let your hand go down there, Chad. Let it go. Reach out, and then we're going to turn palm up to palm down. So we're going to work through this entire range of motion. Everything you can do, you should do every day. Everything you're not getting rid of, all these tight spots, everything that you're not eliminating from your life is getting better at being there every single day. So we want to improve the overall state of the tissues in this region, stimulating circulation, stimulating lymphatic flow, and improving the mobility. Allows for a more graceful aging process. All right, so we work the bicep, tricep, teres minor, up on that. Let's go ahead, yeah, that's great. All that stuff in through there. Now, go ahead and lay down on your back and work the ball like a pillow across your neck. We don't just pay attention to the areas that were sore, we want to pay attention to every conceivable portion of the body that can be contributing to the region itself and the tightness. Just because the muscles of the shoulder, they go up and they work up into the top of the neck and into the skull as well. Chad's going to roll back and forth. Put your pelvis down on the ground, Chad. So right now, he doesn't have a tremendous amount of pressure working on there, and he wants to roll his neck through a full range of motion. Put your hands on your forehead there, Chad, and push back in. You can improve or increase the resistance that you're working with by just applying a little bit of pressure. As you're doing this, Chad, make sure you roll your head in like a circular motion or figure eight motion. There you go. Again, every range of motion we can acquire, we should acquire. There's portions of your brain that are responsible for everything we do, and everything we don't do every day gets a little harder to accomplish. So we want to stay on top of that stuff as often as we can. The reason we're really good at stuff that we do all the time is because we do it all the time. The more you familiarize yourself with all the stuff, it'll get easier for you. That's good. Now roll to your side, use the ball like a pillow. Now we're going to get right on top of the trap. We're going to straighten this leg, and put that foot on the ground behind that knee. Very good. And you're going to push with the supportive leg and elevate your body up onto the ball. Turn sideways there a little bit for me so I can get a little better. Good. Work that up and down like that. Very good. We're getting right on top of the shoulder. And as you're doing that again, Chad, roll your head left and right and lift your head, stretch it away one side to the other. That's very good. And always remember, everything we're doing on one side, we want to do on the other side. Muscular-wise, our bodies are very symmetrical. Again, Chad, what do we do if it hurts too much?
Take pressure out of the ball.
Take pressure out of the ball, reduce the amount of pressure you have on it. What if I've done that and none of that works? I've lightened my contact on the ball, I don't have any pressure in the ball, I've got it down almost flat, and it's still too painful. What do I do?
Well, you could get a bigger ball.
Bigger ball, more specific, less specific contact. I can have more, I can pile on more clothes. I can do it on the bed or the couch. Again, just be smarter than the problem all the time. To complement the ground series, we have a standing series that's going to be a little easier to accomplish as well. So we covered the neck, the shoulder, all the way through the bicep, the tricep, the torso. Let's do a nice easy one. In between the shoulder blades, roll the ball up and down through there and give yourself a nice big double hug as you're doing this. So Chad's going to roll, starts off on the ground, rolling the ball up and down the spine, and he's going to work out into the tissue on both sides, out into the rib cage, and get a good rotation in there, Chad. Now, the reason he's giving himself a big double hug is that's going to slide the scapula across. Just pull one arm across you and use the other arm to stabilize. Yeah, there you go. Yeah. Very good. And so if you need that, put the other hand down on the ground too, Chad, and stabilize yourself that way. Good. So whatever you need to do to make this possible, that's where we're going to start. As your balance and proprioception improves, which it's important to tax that stuff every day as well. Working your balance every day is like taking out insurance against future falls. You avoid the right fall, and maybe you just get to spend that money on taking a trip rather than going to the hospital. Turn you on your side, that's very good. All the way over, very good. From one side to the other, cover all the way over to your chest, you betcha. So rather than think about where you're supposed to take the ball, you should think about how you can take it everywhere. Every aspect of your anatomy enjoys more circulation, more lymphatic flow. The lymphatic system is like the garbage bin of the body. They're able to go in and scoop up all the stuff that's not supposed to be there and get rid of it. Every time we do this, it's a good idea to dilute the trash that your body's getting rid of with making sure that you drink a couple nice glasses of water. So as your body's processing all this, it doesn't give you an upset tummy. How's that feel, Chad? Nice and loose. So we're going to find improved circulation should be warmer and looser and a lot more at ease. You create this environment every day. You maintain an environment where this tight stuff doesn't get to exist, and you'll force yourself to age gracefully. I'm Doc Heff.
I'm Chad McDowell.
We are Easy Pain Solution. Thanks for watching.